Now, it is very important to be aware of lung cancer and how to find it. And so joining us today is the Go-To Center Foundation for Lung Cancer Chief Health Delivery Officer Joelle Fati and social media influencer and model Veronica Webb, who are at high risk. Ladies, thank you so much for joining us this morning.
Good morning, Kimberly. Thank you so much for having us here for Lung Cancer Awareness Month.
So Joelle, tell us,
Good morning.
Why is it important to get screened for lung cancer?
You know, lung cancer is more common than people know. 1 in 4 cancer deaths are related to lung cancer in this country, with only 19% diagnosed before it is spread. You know, it's not a matter of if you'll know someone who's had lung cancer, it's really probably a matter of when it's that common. And we can pick up lung cancers early by low-dose CAT scans. So, you know, annual screenings are a really important thing to know about.
So, Joelle, tell us, what does a screening involve?
You know, lung cancer screening is kind of like an X-ray, but it's performed by low-dose CT scan. And what that means is that it delivers about 90% less radiation than a standard CAT scan, and it can be performed in about 1 to 3 minutes. You lay on a table, it's an open air ring, and you pass through the ring several times, and the low-dose CT is potent enough to pick up something as small as a grain of rice in your lungs. And that's the size of a lung cancer you want to catch earlier rather than later, when it's treatable and curable.
Now, Veronica, you are at high risk. What made you decide to get tested for lung cancer?
Well, I started my career in the 90s as a supermodel, back when nobody really cared about women's health so much. All that matters was that, you know, you looked cool and you were really skinny. So I was young and dumb. I followed the crowd. I smoked. And, you know, I didn't really realize what my risk factors were. Like, I actually have the trifecta. I smoked. I was exposed to secondhand smoke. And my mother also got lung cancer and survived. So there was always this question in the back of my mind. My mother did not smoke. There was always this question in the back of my mind: is this going to catch up with me? Am I going to get lung cancer somehow? And as I looked forward to the life that I wanted to have, being a mother, which I am now, running marathons, which I've done, and hopefully living to 100, I'm getting there. I'm more than at the halfway point. But I needed to know what, you know, did I have lung cancer? So when I partnered with Merck and FocusOnYourLungs.com, I got to go first and take the test so that you don't have to. And it's a really simple test, right? There's no needles, there's no anesthetic, you're not compressed in a machine or caught in a tube, and you're in control most of the time. And in 3 minutes, you can have an answer, right? You know, and that is absolutely priceless. So ask your doctor if it's right for you, and then go to FocusOnYourLungs.com, and you can watch my experience, and you can see it's literally like 1, 2, 3.
That's amazing, and I think you're right. It is so important to be aware of, you know, your potential risk for things. Now, Joelle, can you tell us what the difference in diagnoses is among certain communities?
Yeah, you know, unfortunately, we see a lot of disparities in health inequities in the setting of lung cancer. Lung cancer hits Black Americans and Hispanic Latinx populations more frequently and is more deadly than lung cancers in white Americans, non-Hispanics. And so, unfortunately, Black Americans are less likely to actually benefit from screening. They don't get to screening. Why don't they get to screening? Because they don't know that they're eligible, because they don't know where to go, because people aren't talking about it. So we really need to spread the word and really identify if people are at risk and ensure that people who are Black American and Hispanic Latinx are getting to that life-saving scan.
Veronica, you seem to be just really handling this well and quite the champion. So what advice would you give to people that are at risk and afraid to get screened?
Please don't be afraid. I mean, when you think about it, as a woman, there's so many screenings that we do not miss. If your doctor thinks that you're at risk for lung cancer, go, because the earlier you catch it, And my mom was able to catch it early when she had it, but that was because she was an RN. You don't need, to be an RN now. You can go get the test. And early detection gives you a better chance of survival. And if you're in a position to give yourself more life, wouldn't you take that?
Absolutely, absolutely. Now, Joelle, tell us, what is the community doing to promote screening and really encouraging people to get in front of this potential risk?
Yeah, thank you. There's about 16 million people in this country who are at risk and eligible for lung cancer screening. At GoTo Foundation for Lung Cancer and Merck, we have partnered up to really kind of spread the word about the benefits of screening, where you can go to get screened. You can learn all about this, including whether or not you might be eligible for lung cancer screening, by going to focusonyourlungs.com. I would also encourage you to talk to your doctor to understand if you are at risk and how to get to lung cancer screening.
Well, ladies, thank you so much for joining us here on Mountain Connections this morning. It is just very important to be aware of your potential risks and really be an advocate for your own health. So stay tuned. We have a few more things here on Mountain Connections. We are just getting started. We'll be right back after this.